path of this storm already filled with patience. That tropical storm Isaias expected to make landfall in the coming hours in the Carolinas, possibly as a Category 1 hurricane. Already deadly in the Caribbean, dangerous winds, heavy rain, and a dangerous storm surge as well. Expected to move up through several major cities along the I-95 corridor, all the way to New England. Watches and warnings in effect right now, and those doctors and nurses bracing. ICUs already filled with COVID patients. And the shelters bracing for the storm, how they'll screen for symptoms of the virus. Rob Marciano in the storm zone with the newest track. The president moments ago on the coronavirus. It comes after a member of his own team, Dr. Deborah Birx, said that what we are seeing today is different from March and April, adding it is extraordinarily widespread. It's into the rural as well as urban areas. The president lashing out at Dr. Birx for the first time. And just as the first students returned to school in this country, the one Georgia school district where nearly 300 teachers and staff are out sick, either testing positive or having been exposed to someone who did. And the Georgia high school football player who was asymptomatic, both his parents also testing positive. He lost both of them. Late today, also new.
This is ABC World News Tonight with David Muir.
Good evening, and it's great to have you with us as we begin another week together here. And tonight, as this country fights the coronavirus, millions in the East are about to deal with yet another threat, a tropical storm that could become a hurricane just as it slams into the East tonight. From the Carolinas up through New York and Boston, in New York City, those winds gusting up to 60, even 70 miles per hour. And you're about to hear from doctors worried tonight with their hospitals already full with COVID patients. Warnings posted up and down the coast tonight. Dangerous winds, blinding rain, and a storm surge of up to 5 feet expected in some areas. Wind, heavy rain already near Myrtle Beach tonight. Time-lapse video actually showing outer bands of the system rolling through Jacksonville, Florida today. The Northeast, as I mentioned, now bracing for the storm 2 and the potential for hurricane-force winds set to strike from Philadelphia to New York. So we have the latest track for you tonight, and we begin with ABC's Eva Pilgrim in Myrtle Beach, leading us off.
Tonight, outer bands of Isaias closing in on the Carolinas and threatening the entire East Coast with powerful winds and life-threatening storm surge.
It's moving quickly enough that it won't really have a chance to weaken.
In New York City, they're putting up mile-long barriers in low-lying areas to keep the water out. Coronavirus cases and deaths on the rise in several of the states in Isaias' path. Florida avoiding a direct hit, but forced to close some outdoor testing sites because of Isaias' winds. The Carolinas might not be as lucky.
Shelters will screen people for coronavirus symptoms. Shelters will have PPE and will honor social distancing.
Been here 35 years. We've never seen a situation like this where the hospital has been under this much stress.
Weeks ago, Tidelands Medical Center, just outside Myrtle Beach, had to call the National Guard to help handle all their COVID cases. Tonight, preparing to face a surge in patients.
The hospital is absolutely full with COVID. The ICU is. We're over capacity. The ER is. And now with the storm coming, it's just something else to deal with.
Isaias killed at least 3 in the Caribbean, knocking out power to nearly 500,000 on Puerto Rico. It could stay at or near tropical storm strength all the way to New England.
And we are starting to see those outer bands. This storm surge is expected to be 3 to 5 feet, and this storm will hit at just about the same time as high tide. It's also a full moon tonight, so that means a higher than normal tide and the potential for significant flash flooding. The other major concern here, tornadoes. This area is under a tornado watch until 2 a.m. David?
Yes, so take this very seriously.